We are so pleased to award the Innovative Curriculum Award to Amy Brock. She is from South Carolina, and we're so excited to see this nomination because not only did it take an unusual perspective on rural health, but the kinds of modalities that she used in it was very exciting to us. So Amy, why don't you come on up and accept your award, and she's going to give us a little presentation, and Jan's going to be able to film, so that's wonderful.
So much for this honor. It's like having my mom in the room with Dr. Probst here. I certainly share this award with her, as well as the many community partners who essentially serve as adjunct faculty members and the assistants of teaching. Our wonderful, wonderful cohort of students who are pursuing degrees in public health as well as health administration. And I appreciate this opportunity to share a little bit about this course. Let me tell you a little bit more about what Dr. Probst and I do. We are in the Arnold School of Public Health at the University of South Carolina, and our faculty appointments are in the Department of Health Services Policy and Management. But we spend most of our time in the South Carolina Rural Health Research Center. We are lucky enough, blessed enough, to serve one of 6 rural health research centers that are funded by the federal government, specifically the Office of Rural Health Policy, in HRSA's, within the Health Resources and Services Administration. So we're very fortunate to do what we do and spend the time with the wonderful professionals that we get to do. The rationale for this course, I'm kind of embarrassed to say that South Carolina is a rural state, and I say embarrassed because we don't have the view that we all are experiencing right now in Colorado, and Colorado is certainly rural, if not frontier. But South Carolina, too, is rural and has marked disparities. And in our rural communities, those disparities are absolutely exacerbated by the woeful lacking of healthcare services infrastructure, poor availability of professionals, all the bad indicators that we typically think of when we think about poor and rural. So we felt like we needed to respond by developing this course. Additionally, we felt like this course was a priority because we have a number of students we employ in the Rural Health Research Center, and this was a great way to train them, as well as cultivate leadership in the pipeline of our students who we would hope to recruit and keep in South Carolina and serve the rural communities that we advocate for. So our purposes really are twofold. We want to enhance students' knowledge of demographic, economic, and political forces affecting access to care and community health in rural America, as well as impart a number of key skills, such as improved communication, analysis, decision-making, necessary to affect change at the rural level. We arrived at these purposes really by way of a marriage between the Association of Schools of Public Health Competencies, as well as talking to our vast network of rural leaders. We asked them, what are the skills and the knowledge and the characteristics that you're looking for when you go to hire leaders, whether it be administrators, educators, what have you. So we listened to them, and that really did inform what our syllabus looks like. So our course objectives, certainly we spent a good bit of time discussing the key policy issues and the historical factors that really distinguish rural communities from urban, distinguish in terms of their needs, the policies that affect them. And then we spend some time discussing the infrastructure, both at the national and the state level. So much of what happens in rural systems of care is guided out of Washington, but certainly states have an active role in shaping how systems of care essentially function by way of reimbursement, incentives to recruit, etc. And then we spend a lot of time at the community level, and the pieces that we pay attention to at the community level in this course are educating them on what the components of a healthcare system looks like in rural, that it isn't exactly what you think. We spend time talking about the challenges and opportunities in recruiting providers, both in public health and health services, to come and care for rural communities. Then the thing that's near and dear to my heart is the rural safety net, and specifically the unique contributions safety net providers like federally qualified health centers, rural health clinics, health departments, and free clinics each spend in affecting the epidemiology and the well-being of rural communities. And then finally, we round out with special populations, and the instructor admittedly gets bored with each administration of this course, so we like to keep it interesting and use this as an opportunity to illuminate unique needs of moms and babies in rural America, certainly Hispanic and migrant populations, and definitely, at least in our part of the world, rural African American communities, and the students seem to really enjoy the tapas, if you will, of the special populations. I said that I get bored, so I certainly do like to vary my teaching methods, but there are certain components that I find to be tried and true. I'll discuss the readings in just a moment and the group discussions, but I am so lucky by virtue of the network that we have in our own state and through the Rural Health Research Centers to leverage wonderful guest lecturers from the National Rural Health Association, our State Office of Rural Health, various hospital associations, certainly our Public Health Agency and our Medicaid agency. And these are all very busy professionals who, with enthusiasm, take time to come into the classroom and share their perspective with our students. And they're kind enough to reciprocate. We believe that you can't learn about rural health without experiencing it. There's only so much you can do from a textbook and online, that this really indeed needs to be experiential learning. So there are a number of field trips that we get to do, and believe it or not, even at the University of South Carolina, we get a number of students who've never seen a rural hospital, never seen a federally qualified health center. So we go out into the woods, and we absolutely enjoy that experience. And I like to insert a little cultural excitement as well. And admittedly, we eat at some places that aren't terribly healthy, but the food sure is good, and they enjoy that. We have a number of writing assignments and course deliverables I'll discuss in just a moment, but the field trips really do ignite the fire in the students. I see it every time. Some of the readings, there's no textbook out there. There are pieces of some that address key rural health issues, but nothing that really wraps around the entire rural health experience. So I make them read lots of journal articles, policy briefs, different governmental publications, as well as view some websites. But there's one read that I think is very important, and I would encourage you all to take a moment in your busy schedules if you get a chance to read. I don't get any feedback from Pat Conroy, so I don't get any residuals from his publications, but The Water is Wide is a wonderful read. I think John Voight made a movie out of it 30 years ago, and it's not the same as the book. But he is, of course, an accomplished author, a Southern historical author, but this is a story about him. And when he was a young adult, his first job was as an early childhood educator, and he was placed on one of our sea barrier islands. And he tells the story of segregation and how he worked to champion children who honestly were just forgotten in South Carolina. And it's a telling story. It gets you excited, and at least I identify with my own work in addressing health disparities. And he goes through a period of awakening, and he has to explore his own motivation. And it's a wonderful book for those of us who are interested in health disparities. The parallels between healthcare, rural healthcare, and rural education in a segregated South is just inspiring. So I encourage you to read it, and I make them read it. And as a part of their read, their experiential read, I make them write a paper that synthesizes the themes from the Conroy novel as well as the field trips. And it's been interesting to see some of the deliverables that they've produced. One year we had an opportunity to visit 2 different rural hospitals, one thriving, building a new facility, the other barely making payroll. And they were able to develop a case study comparing the leadership structure, the policy, the politics, the community dynamics. They really enjoyed that and were able to wrap that around the Pat Conroy experiential read. because I want them to all have jobs and go out and do wonderful things in the world, I use this course as an opportunity to bolster their resumes. So we always either do it in groups or in individuals, pick a rural health policy, issue, a program, and make some sort of scholarly presentation. Recently, it's been in the form of a poster at our own state's rural health conference, and that seems to be very popular. They love it, and of course, it's a thing they get to put on their resume. Then the other dreaded things like midterm examinations, which we won't discuss. And I've mentioned a number of the student outcomes. One other thing that I just want to highlight is the work that some of my students recently did, the 2007 cohort. I've taught this class 6 times. We had an opportunity by way of learning from some of our community partners that there was a real need to educate folks on what it's like to practice health care and public health in rural. And it sure would be nice to have a little documentary. So my 2007 cohort did all the background work, and we partnered with our art department, which is on the opposite end of the campus. We have no reason to socialize with these folks, but we struck up an affinity. They got excited about it and actually went to our vice president of research and got a small grant, and we made a documentary. And it has been used in multiple places in our own state to educate policymakers on rural health issues, but it's also been a wonderful little tool for my colleague in the art department. She's won a couple of independent film awards. So in addition to education, it's taken on its own artful expression, and I've provided a link, and Kate and Amy have information on it, and if you would like a free copy of it, let me know. But it is a telling story. It's actually 3 different vignettes of the issues that are plaguing our own state in rural South Carolina. The thing, of course, the measure that I'm most proud of is what students ultimately decide to do, and we have so many students who complete this course. They go on to choose a practicum or a residency experience in rural, which just thrills my soul, and I can give you some stories of where folks have chosen. My most recent prize student left me, went on to do her MPH practicum with our own state office of rural health. She knocked their socks off, she fell in love with them, and was ultimately hired and is running just a wonderful program called the Benefit Bank, where she spends her days in soup kitchens, free clinics, working with public health agencies who are finding uninsured, underserved populations, and through a software package out of someplace in Ohio, she's able to help people identify financial resources that's going to change their life. So that's one of 3 in my recent cohort who've gone on to secure careers in rural public health, and I just couldn't be more proud of them. And I am so honored, just beyond belief, to receive this wonderful award. And again, I share it with my students, my rural health partners, my mentor, Dr. Probst, who is functioning like my mother and is supporting me right now. And so I just want you to know that I know that you had lots of folks you could probably choose, but this means a lot to us. It means a lot to rural. We have been in existence as a research center for 10 years, doing very important work, as you all are, and honors like this really mean a lot and help us compete for another round of funding. So thank you so very much.